Hello everyone, this is Dr. Praveen Salvam, MD Internal Medicine. Today in our Ward 1 section, let's discuss about an interesting ECG where beginners in ECG go wrong most of the time. Let's deep dive into the topic. This is the scenario of the patient, an elderly woman around 70 years admitted with complaints of palpitations and burning micturition. This is the ECG of the patient. You can take 10 seconds to observe the ECG meticulously. Let's solve this ECG now. So, the first step in solving the ECG is to find out the standardization. The standardization in this ECG cannot be made out because the standardization symbol is not visible properly. So, let's assume that the standardization is normal. Let's look at the rhythm. You can note out that the rhythm is not regular. We can find that it is an irregular rhythm. Inside the irregular rhythm, we have to find out whether this is a regularly irregular rhythm or a irregularly irregular rhythm. You can note that the R waves are marked by me now. The RR intervals vary between each R wave. So, this is a irregularly irregular rhythm because this RR interval is different from this RR interval and it is different from this RR interval. So, this is a irregularly irregular rhythm. Usually, regularly irregular rhythm occurs in the case of ectopics, either atrial ectopics or ventricular ectopics. So, the rhythm is irregularly irregular. What is the rate? I have already taught you how to calculate rate for irregularly irregular rhythm. The heart rate calculation formulas like 300 by number of large squares between two R waves or 1500 by number of small squares between two R waves will not work here. The heart rate calculation for irregularly irregular rhythm is completely different, and I have made a special video on that in our ECG BNB YouTube channel. You can refer that video. According to that, we have to count 30 large boxes. Approximately these 30 large boxes will end here. You have to count the R waves within that 30 large boxes. So, it comes around 12 because 30 large boxes signify 6 seconds. 6 into 10 is 60 seconds, which is 1 minute. So, 12 into 10 is equal to 120. Approximately the heart rate will vary between 110 to 120 in these patients who have irregularly irregular rhythm. So, rate is 120 approximately. There are much more finer details in rate calculation for this irregularly irregular rhythm. So, it is better that you refer the video and come back to this. Okay. Next, we have to discuss about the axis. You can note that lead 1 is positive and lead 3 is predominantly negative. So, the axis is left axis deviation. So, the axis is left axis. Next, if you look closer in this ECG and if we find out that it is an irregularly irregular rhythm, when we ask beginners in ECG like our interns or first year postgraduates, they gave me an answer of atrial fibrillation for this ECG. But is atrial fibrillation right or wrong? It is wrong. The moment we say irregularly irregular rhythm, these beginners think that all irregularly irregular rhythm is atrial fibrillation, but it is not here, because if you observe this lead very closely, I will zoom it up for you. If you observe this lead closely, there is an undulating baseline. There is an undulating baseline which I am going to draw now. You can see that I have kept an image of a saw over this and it collides very perfectly. This is called sawtooth pattern. This sawtooth pattern is found in atrial flutter and not in atrial fibrillation. This sawtooth pattern is caused by the flutter waves. These are the flutter waves, 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 these are the flutter waves. Okay. So this is a case of atrial flutter. When I told my interns that this is a case of atrial flutter, they unknowingly asked me one small question. Sir, atrial flutter is a regular tachycardia. But I told them atrial flutter, when it is accompanied by a fixed AV block like 2:1 or 3:1 or 4:1, it is regular. However, there is a different entity called atrial flutter with variable block, and this is also one of the commonest causes of irregular rhythm. Having a variable block allows variable impulse conduction from atria to the ventricles. That's why the RR interval continuously varies. We will go back to the ECG. You can note that there is an undulating baseline here also, and flutter waves are visible predominantly, and they are pointed and have a sawtooth pattern also. Since the RR interval is variable, we can make a diagnosis of atrial flutter plus variable block. Now we will discuss what are the causes of irregular rhythm. The first cause and the most common cause is atrial fibrillation. The second most common cause is atrial flutter with variable block. And the third cause is MAT, which is multifocal atrial tachycardia. And the fourth cause is focal atrial tachycardia with variable block. So these are the four most common causes of irregular rhythm and tachycardia. So we have learnt that all irregular rhythm are not AF alone. It could be AF, which is atrial fibrillation, or it could be atrial flutter with variable block. Atrial flutter can be differentiated into typical as well as atypical atrial flutter, but that is beyond the scope of this video. We will discuss that in a separate video. So how we should treat the patient? This is the recovery ECG of that patient. The patient is in sinus rhythm and the patient has improved dramatically. Patient was found to have urosepsis and she was treated on antibiotics. For this atrial flutter with a variable rhythm, the patient is treated exactly like atrial fibrillation protocol with beta blockers and or calcium channel blockers plus or minus digoxin. We gave beta blocker metoprolol XL 25 mg OD for that patient, and the patient was hemodynamically stable during admission. So with this oral tablet itself, the patient reverted back to normal and the patient is discharged today. In case you are a person who is interested in ECGs, you can check out our ECG BNB app, which is the easiest way for ECG literacy. This app is available both for Android as well as iOS users. For Android users, you can type the name ECG BNB in the Play Store and download the app. And for iOS users, you can download the Class Plus app and enter the organization code which is shown in the screen. Once you log in, you can find the course ECG Alpha, which is present in the store section at the bottom. In this course, entire ECG content is broken down into levels and sublevels. Each sublevel will contain an explanation video in short and crisp format, followed by class notes for easy revision and practice ECGs to solve and relearn. Apart from that, the striking feature is that all your doubts pertaining to the course content will be personally clarified by myself or from the members of my team through the chat support, which is available 24/7. You can post the ECG doubts which you come across during your day in the chat and we will try to solve it for you. In case if you are a student, you can get the course at 70% off. If you find these type of dedicated ECG content interesting, you can subscribe to the ECG BNB YouTube channel for regular learning. Thank you, and until next time, it's bye from ECG BNB team.